Okay, well, Melanie, are you ready?
Ready to go.
Okay, terrific. Well, welcome again to everyone who has joined and continues to join. I'm Sarah Neiswanger, Director of Industry Engagement with the National Glass Association, and I'm excited to be joined by my teammate, Melanie Detmer, Industry Engagement Manager today. So thank you for joining us for this special Thirsty Thursday webinar in recognition of Suicide Prevention Month and Construction Suicide Prevention Week. We're going to forego our usual organizational updates, though dates for our upcoming events through the year end are listed on screen. And we hope you've also been receiving plenty of other communications keeping you informed of what's coming up next. So today's presentation will kind of have two parts. Following the initial presentation portion, we do hope to spend a little bit of time in conversation with everyone addressing some questions and scenarios together. So with that, we will be adjusting the audio settings, allowing you to unmute when it's time to chat. And so you're free to participate and share your ideas and experiences as well. As usual, if you're not speaking, we do ask you keep yourself on mute just to reduce some background noise. And as always, the Q&A feature in the Zoom toolbar, feel free to use it throughout the presentation. And as well, if you just want to share some ideas but don't necessarily want to chime in. So with that, Mel, why don't you get us started?
Okay, thank you, Sarah. And before I get started, I want to get real close here. I appreciate all of you that have joined this webinar today. Sarah, if you could go to the next slide, just to don't play it yet, but just to have it on the screen, please. So today, you're joining us, and we're talking about loss, survivor voices, learning through loss. And I am a suicide loss survivor. And what you're about to see in this great little video, this ode to the foundations, the things I've done, getting ever braver to share my story and make it meaningful. I appreciate you being here. I'm losing track a little bit. So please, Sarah, if you don't mind, play the video that shows kind of my journey along with the NGA and along with all of the amazing people in this industry that have been with me since the day it happened. Thank you. All right, so that was pretty good, wasn't it? Yeah, that was a good video. So we'll come back after this video for questions, discussion topics, whatever. And I hope you will join me in really watching this. It's about 20 minutes, 18, 20 minutes to learn even more about foundations and kind of the journey that we're all on, that we're all in this together with. Thank you.
It is so important to respect and to honor the experiences of those with lived experience because we've been there.
How can I talk to you about what it means to want to live, or what tools you could possibly use to save a person that's in your life without having gone through that myself?
You could be a loss survivor. Someone died, in your circle. You could be an attempt survivor. You made an attempt for suicide. You could be a suicide ideation survivor. You've thought about it a lot. You could be a person who takes care of someone with suicide-centered experience.
My name is Jerry Reed, and I have been in the field of suicide prevention since about 1996. You know, it was one of those hidden problems that maybe we weren't as a country mature enough to talk about, but we got mature very fast when we realized that people have lost a lot. At that time, there was about 30,000 people who were dying in this country every year by suicide.
This is important. People are dying. My peers are dying, and you're not paying attention. Those are like times where it felt like it had to happen. Something had to happen. Somebody had to say something. I'm DeQuincy Mayfrin-Lazine, suicide attempt survivor, a scholar, and an author. Not that long after I started getting involved is when when Congress said, yes, this is a national priority. And then quickly from there, they went to, yes, we should build a national strategy.
And the national strategy was released in 2001. So I would say, honestly, it was the voice of the lost survivor who kind of said, enough is enough. This is preventable in many cases. Let's lift the veil of secrecy and do something about it.
World Suicide Prevention Day, 2010. So I was at the hospital waiting for my son to be born and also waiting for the National Action Alliance for Suicide Prevention to be launched. Action Alliance started putting together task forces, and we were able to put together a suicide attempt survivor task force, which was really exciting to have enough people who are attempt survivors engaged in suicide prevention at the national level or willing to do it at a national level to have our own task force, which was awesome.
And that was an important step. And then once that was done, after we raised awareness, we wrote this 2012 strategy, which incorporated a whole lot of new things like crisis lines and lost survivors and lived experience.
My name is Shelby Rowe, and I am the Executive Director and Principal Investigator for the Suicide Prevention Resource Center. I remember at the time I was working in prevention when the new national strategy came out in 2012. And I saw, looking online on the website, it's like, oh, they have a lived experience committee, and was very excited that our field was recognizing that, because everything up to that point had been fairly hush-hush. I had even been told by a couple mentors, they were like, well, if you have lived experience, if you have ever had thoughts of suicide or make an attempt, don't tell people, because it'll hurt your career chances.
We decided that we needed to express our core values because they were somewhat different from what was in the national strategy, just in that we wanted to pull together some things that were more in the consumer, mental health consumer movement, recovery movement. So a lot of principles, just like having things like hope and, purpose and meaning, involving people who were family and friends of attempt survivors, having awareness of cultural traditions and faith traditions. And we had lots of discussions about the possible titles for it. And one of our members suggested The Way Forward.
And so it really set that framework. It really set the foundation for how our field needed to be better at including and respecting the life experience of those who had had their own personal struggles with suicide.
So my name is Isabel Garcia. I will say lived experiences, access to a very specific set of wisdom that only comes from firsthand contact experience. It's this sort of, you had to be there to understand. You had to be there. It's that type of sensation.
If you were taking a road trip and you were going on a road you had never been on and you didn't have Google Maps, asking someone who had been down that road is going to help you prepare for that journey. And so asking, each person who has had their personal experience somehow they have made it through. And so listening and hearing, people say, well, just because you survived doesn't mean you know how to prevent suicide. And it's like, well, no, but I know how to prevent it for me. And this person knows how to prevent it for them. And there is some collective wisdom from hearing what it was that helped and what was happening at that moment.
So my name is Steele Kelly. We don't know what we don't know. We have to bring folks into the table that may have not traditionally had a voice. Maybe their perspective is a little bit different, or they're able to bring that knowledge that we don't have on those suicide-centered experiences.
My work is me. I am the work. All of my educational programs, all my trainings, workshops, circles, presentations, all of it are about my story. It is all about the lived experience.
I think lived experience reminds people that not only are they not alone, but someone else has been through this difficult part. My name is James R. Dixon. I've experienced a lot of trauma, a lot of suicidal ideation. I've been in war situations and seen really bad things at a very early age. I'm in this work because I think a part of me wants to serve.
I think that also having the possibility even of having a group of attempt survivors in a room multiple times and finding out that was actually okay to do. Just that aspect had a resonance in the field because that opened the door for other groups, other organizations to do that as well, to pull together a group and to know that this can actually be okay. And even better than okay, this can actually have an impact on what we're doing and give a different perspective on things and change some language things that might not get picked up otherwise.
My name is Susie Reese, and I am the Director of Lived Experience Initiatives at the Suicide Prevention Resource Center. I've been personally impacted by suicide in more ways than I can count, and that gives me a different type of experience, a different type of knowledge and wisdom. And so by bringing us into these spaces, you're not only getting stories and terrible situations, and I think people often focus on that, you're getting strength. You're getting consistency. You're getting people that motivate themselves when they don't want to be. There's so much wisdom in the past that we've had to force for ourselves. And I think when we bring that back into the space is stronger.
When I came to the Suicide Prevention Resource Center, and one of my first tasks was put together a lived experience advisory committee. And so I did kind of reach out to different folks because we wanted to recruit people with lived experience from across the country.
I tell my story because it illustrates the impact of intergenerational trauma. I tell my story because it illustrates the impact of services that have gone awry or culturally irrelevant services.
My name is Colleen Solitis, and I am the Lived Experience Initiatives Engagement Manager for our Lived Experience Advisory Committee. I think that lived experience in the suicide prevention world has really been, there's little whispers about it everywhere. It's really come to the forefront that why haven't we been doing this? Why haven't we been centering lived experience? I think that it's become important for so many organizations.
My name's Tom Cruise. I still think there's a stigma. I still think we're behind on social media, and that's just because social media changes so fast, and the platforms change, the audience changes, and how you got to go at each one of them, which is unfortunately why we need a younger, fresher, personnel in here. And there's so much potential out there with so much new people that want to share and help break the stigmas.
I think that there were a lot of fears in lots of different circles for different reasons. Everybody felt like people who had attempted suicide were fragile and needed to be safeguarded and taken care of and protected from everything. And then from the professional side, there were concerns about liability and that type of thing.
You know, it's that in our culture, all of those experiences, you know, you hit a lot of judgment and discrimination and stigma in different communities and assumptions, all of that. I'm Pata Sugimoto. I am the current chair of the Lived Experience Advisory Committee. I think it's important for people to pay attention to lived experience because it's kind of like you're not paying attention to the people who are most affected and most impacted by what you're doing. And that seems really ludicrous to me. Like, why would you not pay attention to the people that are most impacted? And I think it has to do with stigma and discrimination and judgment and all those things.
The issue is not my suicidality. The issue is the reactions from people and what they do when they hear the words, I am suicidal. That's the issue. That has always been the issue for me. For me, suicidal thoughts have never been dangerous to me, have never made me feel fearful. What has made me fearful are people's reaction and then using control, coercion, retaliation in order to address it.
I've been on panels where I was the last person in a lineup right before lunch. They were running late. Everyone was waiting for lunch. And they forgot to say that I was Dr. Pata Sugimoto. They left off the doctor because how could a person with lived experience be a doctor?
In the Suicide Prevention Resource Center, our goal is to help build capacity across the nation for implementing the National Strategy for Suicide Prevention.
So we have a committee that we essentially insert into all of our projects. So say we're working on a project for an emergency department and it's maybe 10 pages of documents, and we are looking for a person who has either worked in an emergency department or maybe sought services there. It could be a number of things. And they help look at that content and tell us, you know, this is missing, or this doesn't feel like it's speaking to me, or maybe my perspective needs to be over here or something like that. And they help us shape that content. So SPRC has a really unique program because, you know, we are an organization that creates content. We create best practices. We offer guidance. We have learning courses. We have content that shapes, you know, what others should be considering when they're doing the work that they're doing. We have all sorts of toolkits and all of these things that are geared at every type of perspective, every type of setting, you know, whatever it is, wherever you work, whoever you are, there's something that we can help you understand when it comes to suicide.
We have committee members that are influencers. We have committee members that are clinicians and have worked as a clinician for a really long time. We have committee members that have worked with peer work. We have committee members that have built peer programs entirely. They're all leaders in the field in some way.
I've worked on a toolkit for a national 988 hotline, a couple of other projects, but it's been just so humbling to be able to be a part of such great work, to also be included, to be able to talk and have my voice heard, and to be able to talk about how we could give that same voice to the rest of the lived experience community.
The people in LEAC want to see me thrive. I can talk about these things and meet other professionals that can help me find different interesting ways to do the work, something to bring back, something to share, even if it's just for us to sit and hold space with one another.
The fact that I am compensated, not only compensated in terms of emotions and but money, that I want to put out there, because many times, a lot of times actually, I am asked to do things for free. And I always wonder, what if I had a PhD? What if I was a researcher? What if? And so the fact that I don't have to question that is a big relief.
They are experts in their own experience. And if they are making our products better, we need to recognize and compensate for that.
We're not necessarily just sharing people's stories. We do that on occasion, but most of the time we're really trying to help people with technical assistance or knowledge or things like that.
Most people who have been suicidal will recover to some degree. Most will, like 90% of people will. Recovery should just be our expectation.
We inform, but we also want to, in terms of growth, have things come from us. Like, what does the field need from the lived experience space? And I think that's what we're working on now.
What we need to do is continue with the LEAC, keep pushing this message forward, and then what group's going to be next that's going to come to the table and be like, you know what? And it's all testing. Like, we'll test it out. We'll see how you do for our group, and then we'll jump on the bandwagon. So I think we're doing good.
On our SPRC website, there are 5 things that are crucial to the key to the success of your prevention program. And one of the things on the key is center lived experience. If you are going to the store and it's really urgent, you never forget your keys because you know the keys are important to your journey to the store.
Because you need us. There's missing information. When you don't have lived experience at the table, there is a ton of context missing. You can have the theory, the framework, but where's the real life experience? That's the heart.
So I would love to see organizations over the next 5 years really engaging those with lived experience on each and every project. I think that's huge. That will bring just so much perspective, and it'll build connections, relationships.
It brings a richness and a depth to the work, and it broadens the potential questions that are being asked.
And it feels so wonderful that we, in a big country like this, in a big world like this, we were able to dive in, drill down, and make change happen. So I would just say, stay the course, go the distance.
I just think we need to talk about it. Like, as a culture and as a society, we need to talk about mental health. We need to talk about suicide-centered experiences. We need to be able to share this without flinching and, oh my God.
And I have no doubt that in 10 more years, when the next national strategy is written, that the foundation that's been set up to this point, they will build skyscrapers unimaginable on our foundations.
All right. Pretty good video. So to really just to tie that all in together, purpose of this webinar that you've joined us with today, I started out in the glass industry in 2003. My brother died by suicide in 2006. At work at Brin Glass in Minneapolis, through sharing my story, what had happened, I had 2 coworkers open up to me. One had lost a brother, one had lost a son. And I had a unit there, and more than just them supporting me, but I had them there. They're at Pat Rome, just to drop a celebrity name, Glass World. Him and I started going to the Minnesota State Capitol for mental health days and advocating that way. And please, I'm just sharing my story. I'm not trying to like, here's a step-by-step plan, but I'm sharing my foundations up to the point of the video you saw come from me earlier. By the way, Patrick Detmer, he joined Apogee last year. That's my cousin. Him and Trevor are the same age. So way to go, Pat. I don't know if you're on here. So that turned into Capitol Mental Health Days. 2012, we did an AFSP walk, our family, and we were the #1 fundraiser there. And then it turned into around 2016, I finished my degree at St. Kate's, and I was given presentations in the classroom. to NAMI doing suicide survivor voice training, to discovering Dustin Anderson on LinkedIn, glass guy, talked about mental health. And then well, here we are almost. So then my husband and I got a wild hair and we defected to North Carolina from Minnesota. Skull, by the way, I know Kristen's on here. And I ended up with this dream gig here at NGA. So that turned into opening up to my teammates in 2021 here at NGA. And then in 2022, as you saw in that video, that we had that session. And then we're pulling in big names like Richard Bright from ASA, Cal Bayer, Dave Vargas, and so I'd say to this webinar now. So I hope you all will join me. And Sarah, I think that's it. If you want to touch on anything I probably missed, that'd be great.
I think you did a terrific job laying it out, Mel, and giving us all an opportunity to contribute to the conversation, or at least share some ideas or strategies. I'm going to do my best to change everybody's audio settings so that you can all speak if you'd like. And then with that, yeah, I'm just going to go through and allow you all to talk. And as you get that notification, feel free to raise your hand and chime in. And otherwise, we can scroll back to the resources that we posted. These will also be available. We hope you use them. I mean, one question off the top, Mel, from your experience, was mental health first aid any part of your past employment history or part of staff conversations, staff meetings, anything like that?
That's a great question. Because so go back to 2003 if you can, and just think about, like the water we all swam in but didn't know, just the culture within. And this kind of coincides with generational thoughts, like my mom wasn't, well, I digress, we'll say that for another day, but not really. But the culture of Bryn was great. We had potlucks, we were close, like we did kind of talk about it. And then you bring in, let's say, my generation, and we start opening up more to that point. So not officially did we have anything, but we worked towards it, like we're doing right, here.
And they're suing.
Oops, Holly. All right. Yeah.
Great. Well, I might ask if anybody else on. Oh, we have somebody who's raised their hand. Let me see, Jenny.
Yeah, so my name is Jenny Chase. I am also a co-worker of Mel's here at the NGA, and I also have a lived experience with suicide with family members. And to, on a positive note, Mel, what you were saying about the generations is that I am finding that Gen Z is much more open about mental health. They are more open to sharing their feelings, sharing their struggles. And as employers, that is something that, while it may be uncomfortable for us, I would encourage you to lean into, and to make sure that as employers, we have, it's not our job to take care of them, but if we have resources that we can point them to, I think they are more likely to express what they're going through, and we have opportunities to support. Would you agree with that, Mel?
Oh, yeah. And I think that's exactly what, as we're bringing it all together, us, like our journey together on this, right, Jenny, that's, oh my gosh. And by the way, Bethany, Wendy, like it's been a cool journey. That's what we're working on, gathering the resources, doing webinars like this, like keep building. So yeah, absolutely, Jenny.
And we do have some resources, am I correct?
Yes.
On this topic on the glass.org website. Yeah, absolutely. So I would encourage you to look at some of the podcasts we've done in the past, some of the main stage sessions that we've done in the past, because it is, you know, as they were saying in the video, a topic that if you haven't lived it, you may not know much about. And it's certainly not a comfortable space for most of us. So the more we can become educated about this, the better. So I would encourage you to check these out.
Well, and it ties in nicely to those of you on the webinar with some lived experience. One of our other peers at NGA, Lori, posed in the chat, you know, people often don't know what to say to suicide loss survivors, so they may not say anything at all.
I don't even know what to say, Sarah. So
Well,
like,
that's what I was going to ask, you know,
like,
how
you're not alone.
yeah. So if something had, you know, how do people approach you? How do they what do people say that would make you feel seen or you know, valued in this situation?
Yeah. Well, and since Lori, and I can't see those questions, so I'm glad you're reading them. Lori, it's gonna be fine. But you know, Lori's had some heavy stuff in her life. We all get the heavy stuff. It sucks. But just you kind of do recognize each other, I guess they're out in the world. Like hearts find hearts, or you find your people that way. And she's been such a great person to get to know and here at NGA, and we use dark humor, as we call it, to get through the tougher days. And I'm gonna just tell you what it is. It's this horse that like runs in, it's a YouTube video, runs in, kicks a tree and farts on a dog, and it runs off, but it helps. So that might be a pro tip, life hack. I don't know. Lori, I gave up our secret, but
well, thanks for letting us in on it now.
let me know if I need to cut my mic at any time.
Well, terrific. Well, we thank you again for joining us for this conversation. Yeah, Kristen on the phone hadn't heard of the term lived experience before. Neither had I actually, so I'm learning some new things continuously when it comes to suicide prevention and loss. And so glad that more information is becoming available on it. And make sure you do check out our website, as Mel gathered these resources here. Jenny mentioned them as well, and they'll be included in a follow-up email that you'll get. And also stay tuned, because you know we're continuing this conversation into next week for Construction Suicide Prevention Week, and we've been putting out some polls on LinkedIn, and Mel has some great questions for you that will be posed on Monday. So we do hope you'll find NGA on LinkedIn and engage in that poll, because it's all helpful information for how we address things moving forward.
Sarah, and kind of like working in real time, you're gonna watch us work here live on air. Amy had a question, but you know, if you want to put your questions in, I can send out an email to the group with just like we can start a conversation that way too, or you make sure you guys all have my email. We can just talk. I mean, and no pressure, like just be people. So send them in.
And you know, just for those who have experienced a loss and you've had to take off some time, and then that coming back, how that feels, knowing that maybe coworkers want to welcome you with warmth and encouragement, but not knowing how. So I think it's that social balance too, of the person living the experience and the person trying to be sensitive to your experience, that I think is always that line we're trying to figure out, isn't it?
Yes.
Mel, what would you say? Do you have any, or anybody else on the phone? You can put it in the chat, even, you know, if you
I guess my best and worst advice is you got to go through something like this, and then about almost 18, 20 years later, you just are really just tired of it, and you just seize the awkward and you just start doing it. Or listen to anything Dave Argus, by the way, to feel inspired to it. But it really is just be like, And NGA here, we're very virtual with our team too. Like, so sometimes that's even an extra layer, but just try. Just be weird. Get awkward is my only advice.
Yeah, well, I'm certain there's nothing offensive that you could say.
That's what, yeah. Let's say with the common understanding, we all have common sense, and we're coming from our very caring hearts, which I feel would be the case if that's what you're thinking about these things.
Yeah. Well, terrific. Mel, do you want to type your email address into the chat in case people want to reach out to you directly? And if there isn't anything else, Mel, do you have some final words that you'd like to share with the group before we sign off?
Well, of course, I'd be like, I want to hug you all at Glass Build. So I hope to see all of you there, who I'll find out who is all here later. And also just kind of along the lines of a talk like this, you and Katie and all of NGA, the Great Family Business Theme Day at Glass Build that we're having, just kind of like putting it out there, but we are focusing in more on getting us together to have these discussions to just get through life and business and all of this stuff together, like all my favorite things. So stay tuned for more and see you at Glass Build.
And on that note, Mel is organizing a member meetup that first afternoon, Tuesday the 4th.
Correct. In the last 45 minutes of the day. Okay, so all our amazing NGA leaders will be there. It's gonna be happy. It's a happy hour. So you better be there. You're an NGA member.
Yes, well, it would be awesome to put some faces with names that we see here today. So we hope to see you again very soon.
All right. Thank you.
All right. Thank you. Have a great afternoon.
Thank you.